Welcome to July 24th, COVID office hours from the Balance of State COC. No, I'm not in Alaska. I'm running out of hats. This is very warm. If you start to see me sweat, this is the sacrifice I make for y'all. So I hope you appreciate it. And a little later on, we may see someone else wearing a hat. Again, this is open invitation. Anyone who wants to wear a hat, feel free to do so and put yourself on camera. So a little bit of levity in the midst of some really trying times. So as we do each meeting, we're gonna take a moment of silence just to remember those who have fallen from COVID and racial injustice and just everything that's broken in our world. So let's take a moment of silence. Great, thanks. So our agenda is similar to what it normally is. We've got a great presentation at the end about actualizing your role in race equity with Monique and Mia, so looking forward to that. Just a couple announcements before we get updates from our partners. There are some new resources. The CDC has a new link on calling all Americans to wear masks. That has only taken 4 months. Oops, sorry. I'm not supposed to be political, my bad. But lots of resources. Again, every link that's in the PowerPoint presentation is a link that you can click on and it should take you to another resource. If not, let us know and we can send you those resources directly. Reminder that we have a chat box. Feel free to ask questions at any time. And we'll answer them if we can. If we can't, we always get back to folks. And one of our last slides will show you where to click on for the whole history of every chat that we've had and every PowerPoint that we've had. So without further ado, I think I'm going to turn it over to Steve from Department of Housing for updates on some new exciting assistance programs. Steve?
Sure, thanks, John. The Department of Housing released end of last week a new program called the Temporary Rental Housing Assistance Program. You can call it TRAP if you want, or not. This is a $10 million program in order to assist folks who were affected with their rent due to COVID. This started live. We all know that there certainly are some issues with the call center, which is the number at the bottom. The demand has greatly outstripped the call center's ability to keep up with it. They're allowed to have 50, and we expanded the ability up to 250 calls at once, but still, so many people are calling looking for information. So they decided to set up this program with different priorities. So the first priority would be those folks who have fallen behind on their rent and they were denied unemployment assistance from the Department of Labor and who have a minor child within the household. So how that's going to work is those are the folks that are getting a priority for the first 2 weeks. If there's still funding available after those first 2 weeks, it will move to the next one, which would be those who are denied unemployment and who do not have a minor child. And both of those categories are for folks that are at 60 or 60% or below of area median income. And then if there's still money after those 2 weeks, so after a month, it will just be open to anybody who is at or below 80% of area median income. So once again, try to call that line. I know there's difficulties. We're working on that as well as potentially getting online capabilities to submit applications. So if that does come up, we will certainly let you know, which should greatly reduce the need for a call-in center. So that is great there. In terms of our world, pretty much the status quo from last week. DOH is working on contracts. I know, John, you signed your contract for the rental assistance. So I'm just waiting for the commissioner to sign off here so then we can actually have the $2 million to get folks out of hotels and out of shelters, which would be excellent. The other providers that are doing the support services, we have received all of their workbooks, so we're working through that, and then hopefully within the next week or so we'll be able to start issuing contract docs for that, so that will be fully operational. Also working on getting FEMA reimbursed for the hotels, as well as working with the cans to ensure that they have the funding that they need to kind of catch up with all the COVID-related costs that they incurred from March to June. We've asked the cans to do the same process from July through September, give us estimated costs that are COVID specific, and we will do our best to find resources to be able to provide that level of funding. The second round of ESG, which includes funds for the cans, funds for diversion, as well as additional rental assistance for rapid housing and staffing as well, is working through the process. We have to go out and place that for public comment, so we should be doing that next couple of weeks. So that funding should start to flow probably sometime September, October range. So that's where we are with DOH and all of our programs.
Great, thanks, Steve. The next slide I'll take because Alice is on vacation. Suzanne Wagner is on vacation too, but she just can't stay away from us. So she's joining us, but she's not going to be presenting like she normally does. So for DEMAS, the waivers have been extended. And again, a link to that in case you're interested. There's 2 outreach trainings that are happening on the 30th and August 6th. So there's a link to sign up for those and get more information. The crisis counseling grant that DEMAS got, I'm pretty sure that's through FEMA. They're working through the cans for referrals. So just stay tuned for that. And if you're part of a can, you may have already heard sort of how they're trying to get that operationalized. But it is short-term, it's 15-minute increments, limited number of increments per person, and it's just for crisis counseling. So I know folks have sort of been sniffing around to see if it could be used for housing. It's not, it's very specifically for crisis counseling. So if you're not connected to your can and you think somebody could benefit from that, connect to your can. And then lastly, the training catalog is just about to be released next month, and all of their trainings that'll start in September and henceforth are scheduled to be virtual. So if you've taken advantage of those good resources in the past, keep your eye open. I'm sure they'll do a blast, and we'll make sure that we've got a link once it's live on one of our slide decks so that you can take advantage of their really good trainings. So that's all I got for Alice and DEMAS. Alana, welcome.
Thank you, John. Good morning, everyone. Hope you're all doing well today. I don't have a lot to report on behalf of HUD. We all continue to work under the auspices of mandatory telework. We did, however, bring a new employee on board this week. Her name is Phyllis Fusco. She's joining us as a community planning development representative. She had worked previously with some of our housing authorities in Connecticut, also worked with the COC program for New Opportunities Waterbury. So we're very glad to have her on board. The ESG and CDBG CV notices are not out yet. So we continue to operate the program under the auspices of the legislation that was passed. I know some of you have asked about the ESG expenditure deadline that will be published in the notice when it comes out. I know our headquarters colleagues are working as fast as they can to get those notices issued, so be on the lookout for those. There is an updated resource digest for COVID-19 available to all of you on the HUD Exchange. And the burning question, the 2020 COC NOFA, I don't have any information on that yet. And that's about it from us.
So while we greatly appreciate our partnership with Alana and the HUD field office in Hartford, we sure wish that they would issue crystal balls to their staff who could look into the future and see what's going on with future releases of the NOFA. But as soon as any of us hear anything about that, we'll certainly pass that news on to you. So thanks, Alana, for always jumping on and being a partner with us here in Connecticut. Linda Casey is going to do an update for CCH.
Good morning, everyone. And I promise next meeting I will have a cool hat. I feel a little left out. So John, you have started a trend there. But my update for the next slide, please, is really just to recap. And I'm hoping this is really just a review for most folks, but I know a meeting as of even last week, there was still some confusion about the process for testing for shelters. So I put together this simple slide, really easy 6 steps. Just to show how this process is supposed to go along. And I know a lot of you are and have been doing testing and it's going very successfully, but this is just a reminder of how it should happen. So the shelter provider, and you can certainly read this yourself, but basically after you schedule your point prevalence testing at your shelter or hotel, if it's still happening at the hotels or where it may be, ask the testing provider to send you a list of, you give them the list of guests and their HMIS-ID numbers. And the testing provider should be sending you and ask them to send you their release of information, as well as their consent form for treating. That's the treatment. So the ROI, what that does from the testing provider is to allow you as the shelter to get the results from the testing provider, in addition to what the client would receive. The consent form is just the consent to actually get the test. But get that ahead of time so you give your shelter guests time to sign it and date it. And when the testing provider shows up on site, you basically they will collect those ROIs, have them ready again, make sure they've had the HMIS IDs on them. And then once those test results come back to the testing provider, they can then send them to you. Excel is obviously an easy way, but any format that makes sense for you folks, you will get those test results directly from the provider for everybody who signed that ROI from the testing provider. And remember, everybody should have the ROI signed for HMIS, so we have both angles captured there from a privacy perspective. What we're asking for to get into HMIS ID is just the HMIS ID, rather, the test date and the test result. And you can either enter that manually yourselves at the shelter if you have capacity, or just upload it. Again, Excel spreadsheet is what we are asking for. We have a secure Dropbox and you can send the link. If you don't have that, my information's on there. I know this has been going around. I feel like kind of a broken record here, but hopefully this will clarify. And again, as of last week, there were still some questions. So I'm going to pause there for a second. Is there anybody have any questions about this process? I don't see the chat box lighting up, so I guess that's good. And before we transition to me, I just wanted to share, this is again, initial data. I know folks are working still on getting the testing done, at least for this first phase, and getting them into the HMIS by next month. But I just wanted to share some preliminary information that from this morning's poll. It looks like we've had 19 positive tests come back. 372 of our all guests, anybody with the open enrollment, we've had 372 folks tested. It looks like 10 of them are white, 7 of them are Black, 1 person is Asian, 1 client did not know his race. 14 of those folks were male, 5 are female, 4 are Hispanic, and 15 are non-Hispanic. So that's just a little taste. Again, this is really early. We're going to be doing a lot more than just simple statistics for you, but this is why this data is important. We're going to be understanding a lot more about our population and how COVID has affected us as we get more data from you folks into the system. And we are thinking about ways in our team, if we're going to have a dashboard, or the best way to get that so you can actually have this information at your fingertips and provide that insight. That's all I had. Oh, I take that back. There are, and I think it's the next slide, just from my team, from the CCH team, we have some upcoming webinars, and I have a little more content to share for the addressing the radicalized trauma and Actively Engaging in Anti-Racism webinar, which is next Thursday from noon to 1. This is the content. This webinar will discuss how to be active participants in anti-racist practices and begin a discussion on navigating and addressing racialized trauma. Joining us for this webinar are national, statewide, and local change makers who are leading efforts to end homelessness while centering race equity. Very exciting. And the next one that's coming up August 14th, the components of an effective outreach system. Here's the blurb for that. This webinar is the first of a series that will focus on the different components that make up an effective outreach system. During this webinar, we will cover the conceptual framework of outreach, record keeping and data, outreach during COVID-19, and how to have an assertive, trauma-informed, equitable approach to outreach. So 2 webinars I'm sure you will not want to miss, but that is it for me. I know you are probably waiting for the exciting presentation from me and Monique right after this, so I will turn it over to them.
Great. So we'll just take a pause to see if there are any questions for any of our partners. Steve at DOH, I can take back questions to Demas, anything for Alana at HUD or Linda at CCEH. Take a moment. Just want to do a shout out to Bo Anderson, who's wearing a funky hat. Thank you, Bo. Oh, it lights up even. Nice, nice. Okay, it doesn't seem like there's any questions, so we're going to move on to our special presentation with Monique and Mia.
Just want to mention, I do have a hat. It doesn't fit over my braids, though.
Oh, it doesn't matter. It looks good. Oh,
but I'm repping my sorority. Well, Monique and my sorority. We're actually in the same sorority, aka Alpha Kappa Alpha.
Nice. And thank you, Monique, for being willing to play along the game too. Good on you too.
Thank you so much for inviting us here today.
Good morning, everyone. So we are thoroughly excited to share in the hat challenge with John, as you can see, and to also be here with all of you this morning. I am Monique Price Taylor, and my pronouns are she, her, hers, and I'm from CSH. And our other presenter this morning is none other than
Mia Bryant. My pronouns are she, her, hers, and I'm from CCH.
And we're going to talk
on the next. Oh, go ahead.
Sorry. We're going to talk to you a little bit about actualizing your role in race equity this morning. So one of the things that we wanted to share with you is during this presentation, we'll talk about the relevance of race, embedding a racial, next slide please, embedding a race equity perspective and identifying equity gaps and how to move race forward. So typically when we talk about race, we like to give you some equity and practice guidelines. And so what we really want you to think about today, next slide, please, is that we want you to think about trying on something new, to think about how you're going to experience, or you may experience some discomfort, to really sitting with that discomfort. If you are typically a person who would speak more frequently, move up your listening. And then if you are someone who may not speak often, move up your speaking. So think about the intent and impact. Your intentions may be one way, but your impact on someone else they may experience it differently. Use both and thinking. Notice the content and the process in which we are giving this to you. And then also practice some self-focus as we're going through some of the topics that may be a little heavy. Expect and accept non-disclosure. We're not going for the solution. We're going through a process. And then lastly, we cannot ensure that you will feel safe, but we will make sure that this is a brave space because we don't know what safety means to you. So as we go through this conversation, just think about these guidelines. And I'm going to turn it over to Miss Mia to kind of segue us into why we're here to talk about race.
Yes, so on the next slide, we have the bold question, why are we talking about race? Yes, doing these presentations, we still get that question. And so we always want to level set and talk about, why this topic is so important. And truly, one of the answers is that that we can't truly end homelessness until the system works for people that it was not intended to work for, and that all systems work for people that it was not intended to work for. So we need to address systemic issues that contribute to racial disparities and people experiencing homelessness, as well as address any internal systemic issues that perpetuate racism within our homeless response system. On the next slide, I just provide you all some stats, some data points or some points I'm going to highlight, which is that Black, Indigenous, or other people of color, that's what BIPOC stands for. So Black, Indigenous, or other people of color experience homelessness disproportionately. In Connecticut, Black or African Americans, people of African descent, account for over 30% of people experiencing homelessness, despite only representing 10% of Connecticut's general population. We also see these racial disparities in COVID-19, and that's why it's very important for you, as Linda said, to collect this information in HMIS on COVID-19, because people of African descent account for around 20% of Connecticut COVID positive cases and around 50% of COVID related deaths. So we want to understand how that is occurring within the homeless response system as well, and develop ways that we can help to mitigate those disparities. Also within our PIT count, we are consistently seeing a number of a racial disparity in those numbers as well. So over 40% of all who were counted were BIPOC, and over 80% of those within that BIPOC number were of African descent. So not only are we seeing racial disparities, particularly in people of color, but particularly people of African descent. So there's definitely, something happened there and something to be paying attention to. On the next slide, I just draw out some racial disparities that were found in returns to homelessness within our system. So in emergency shelter, people who return to the system after being exited from emergency shelter to the following destinations below, which is permanent, temporary, emergency shelter, institutional, unsheltered, other, or unknown. We saw a racial disparity in people of African descent being having greater returns to homelessness. On the next slide, we also see racial disparities in those being exited from rapid rehousing and to those destinations, and there being some racial disparities there as well. I've worked a little bit with Bo and internally with Linda's team on collecting some of this information, and there were significant gaps that or issues that were found in trying to retrieve this information. And so in the what to do about it section, we'll go over some of those gaps and trying to be able to collect and analyze this data on an ongoing basis so that we know what's going on. On the next slide, I just highlight some systemic contributors to racial disparities in homelessness. And with that, highlight some opportunities for collaboration and for cross-system collaboration. In criminal justice, Connecticut is number 6 when it comes to disproportionately imprisoning Black adults, and number 8 when it comes to disproportionately imprisoning Latino adults. Sorry about that, Latino adults, number 8. Also, 69% of those matched during our data match with Department of Corrections were people, 3,652 people were matched during this data match, and 69% were homeless prior to the last Department of Correction release, and 28% became homeless after their Department of Correction release. We saw racial disparities in those who were matched. So 35% of those who were matched were of African descent, 44% white, 20% Hispanic, and 1% other races. We also found that there is a significant population of youth when counted in the youth count who had criminal justice involvement. So we know that there is a significant overlap there. In child welfare, African American and Hispanic children are more likely to be substantiated against for maltreatment, removed from their homes, and remain in care longer than white children. There's actually a Department of Children's 2019 report that this information comes from with specific data points, and it's part of their racial justice data activities and strategies report if you guys want to look it up, and I can send it to you all. Also, wanted to highlight that point because our 2018 youth count showed that over 33% of the youth who were counted there had DCF or foster care involvement. and 42% of that group were still involved in foster care or DCF at the time of the youth count. And so we are actively seeing the same populations of DCF folks in the homeless response system, and experiencing homelessness who are not part of seeking or getting services from the system. In the education system, we know that, and this is part of one of their racial justice reports from 2018, that despite comprising only 12.9% of the Connecticut school male population, Black males represent 29% of suspensions and expulsions. Black females comprise only 13% of Connecticut school female population, yet 39% of suspensions and expulsions. And we know that suspensions can lead to family conflict. They can lead to family conflict, can lead to youth homelessness. And so we definitely want to be paying attention to our relationships with McKinney-Vento and with the education system on how we can reduce these suspensions and expulsions and make sure that our students and children have a solid foundation so that they do not appear in the homeless response system, whether as children or later on in life. And also, I just want to bring up I mentioned healthcare, but I also provided you guys an example earlier about the racial disparities in COVID-19. And we know that COVID-19 is disproportionately affecting people of color as well as people who are 65 plus. On the next slide, we get into what we can do about it, and we could just go on to the next one right after that, on some action steps that you could take, especially during COVID, having the additional consideration of COVID-19 and what challenges that presents. So flexibility, and this is not just for clients, but also for staff members. For clients, you want to make sure your program fits the client's needs and not the other way around. So consider ideas around, considerations around compliance, prioritization, compliance, especially when you think about whether someone is complying with COVID-19 regulations or social distancing rules. How can we better work with people to understand how to be safe in ways to practice safety in their own ways that still follow the guidelines without necessarily penalizing people for not following along with the protocols. Also flexibility for staff, understanding that some of our staff are part-time, some of our staff are not getting health insurance through our organizations. Many of our staff are parenting and their children are not in school right now. So having flexibility and consideration about how we can provide that support for our staff members, especially part-time workers who are dealing with the COVID crisis and experiencing some difficulties because of that. Growth. So we want to make space for direct service providers at decision-making tables. So considering this meeting itself, CT BOS, considering our CAN meetings, our housing placement meetings, meetings within our organizations that we're having about programmatic changes, about policies. How can we better integrate those conversations to include Black, Indigenous, and people of color, which in our system, in terms of staff, is heavily on the direct service side. And so they often, if we're only allowing directors or executive directors, management to be in these meetings, what voices are we leaving out? And also people with lived expertise. And we want to make sure we're constantly getting feedback from people who are doing that direct service work, who truly know and understand firsthand what's happening with the clients that we are serving, as well as people in our system who are receiving services as well. So self-care, especially for BIPOC, just considering that there are people who work for us within our agencies, as well as people who are receiving services from our system, who take public transportation and may have a greater exposure to COVID, who are working in shelters and in congregate settings and may have greater exposure to COVID. And again, part-time staff and other staff who may not have health coverage offered through us, and understanding that health coverage is very expensive. So considerations about how we can support and keep our staff safe. Also practicing self-care, considering trauma, the trauma of Black, Indigenous, and people of color being disproportionately affected by COVID. So the likelihood that we might know several friends and family members who are dying and are suffering from this disease. And also considering the fact that, you know, with the racial climate of today's society, what racialized trauma we may be experiencing because of the threat, the fear of police contact, because of the recent deaths that have happened. Family members, you know, being triggered right now because knowing ourselves having experienced situations with police encounters, but also knowing people that have died at the hands of police, and just being able to support our staff as well as people who are experiencing homelessness, who are dealing with this very real trauma that is happening right now. And lastly, services. So I mentioned already, just, you know, making sure that our services are really tailored to fit the people we are serving, and not trying to fit people into our boxes of, you know, what is appropriate for them or what they should have, and having this kind of savior complex. Also, how can we build community? So thinking right now about being time for voter registration. How are we marketing this and giving this information to people who are experiencing homelessness, as well as our staff, making sure, especially in our advocacy for homelessness, making sure that they're paying attention, that they know how they can access, you know, their right to vote. Maybe they need to, if they're recently placed in housing, they need to update their address so that they can, you know, register within their district. You know, providing them, maybe they don't have the technical abilities to be able to go online and register. Thinking about the 2020 census, these are all part of how we can help build community with, you know, amongst people we are serving, as well as, you know, as a system. How can we be sure that we are being responsible in exercising our right to vote, and being thoughtful about who we elect in these offices? Also, in terms of service, lastly, just being client-led, trauma-informed. We want to do you know, practice and implement our programs through a racial equity lens. But for those who are white, you're never going to get to the point necessarily where you understand what it's like to be a person of color. So having those voices at the table, and really allowing people to share, express what they need, and create their own housing plans, their own goals. That is a way that you can also center race, because the people that's coming from are BIPOC. So being client-led is extremely important. On the last slide, I won't go through all of these. On the next slide, I'm sorry. I won't go through all of these, but these are just some examples of opportunities based on the different themes that I mentioned, in terms of cross-system collaboration, in terms of internally making sure that we're not perpetuating racism. These are ways that themes that we can pay attention to and think about in terms of how we can actualize some of these goals that we have. Also want to mention that I'm part of the Race Equity Network, and with the National Alliance in Homelessness, and we recently released some action steps as well. So that's a document that you can refer to that I'm happy to share. And now I'll turn it over to Monique to talk about some collaborative efforts at CSH.
Thank you, Mia. So we've learned so many different things from the collaborative, and as Mia has already raised, the many valid points of what the data tells us, that when we begin to take action, we really want to ensure that we're providing an opportunity of growth to take place. And the only way that growth can take place is really by going back and assessing what went well, how do we improve it, and getting feedback, as she said, from those people of color, from BIPOC people who are involved, or if they're not at the table, how do we bring them to the table? How do we hear from those service providers of what they need, not only just in our segment of what we do, but statewide as stakeholders? And thinking about that space, the space for that support, the space and support, the space to really do what they need to do to see what the reality is from their perspective. So we know what the data says, and we know the gaps. We know the statistics, but what do we want to do with it now that we know those things? And in doing this, what we learned through the collaborative was that we needed to create the space to cultivate collaboration. And as Mia mentioned, not telling people what collaboration looks like for them, but allowing us to hear from them how do you want to collaborate? And so this is something that the Race Equity Collaborative has done. And one of those main things was to bring diverse stakeholders to the table. So we learned cohort 1 that it was a lot. We had a lot of CAN involvement from each region, but we were missing voices of, we were missing BIPOC voices. We were missing people with lived expertise. So this cohort, we were intentional about who was allowed into the cohort and creating that space. So the second cohort, we now have people with lived expertise. We have youth involved. We have someone from the DOH involved. We have DCF involvement. And so we wouldn't have known that if we didn't go back and really assess, like, what did we learn from cohort 1 that we can now enhance or amplify in cohort 2? The other piece of this is using the framework as a guide. So the framework, yes, it was released in 2019, and I hope that it's not just something that we put on the shelf, but we pull out and we refer to it. There are a lot of great things that are in there that helps us to continue to look at how we advance race in Connecticut that were directly brought to us by voices of people of color who experience our system statewide. So Mia also referenced self-care, and I want to bring into this conversation the fact that racial trauma is real. And we have to make sure that as we are creating these spaces, that we create a space of transformation, because there will be a lot of things that are revealed as you start to peel back the layers of race. So thinking about collaboration and providing that space for members to be vulnerable. And that is something that we make sure when we are doing the work of the collaborative, that we allow that vulnerability to be present. We work through our learning series and sessions about what race looks like. We talk about the intersectionality of race and data, but then we don't leave out that self-reflective pieces. When was the first time you were exposed to race? And what was that experience like for you? Because in order to do major change, you have to start from the inside. Thank you. Next slide, please. And so what we did was we breathed life into the framework. So the first cohort, we had cohort 1, then we had cohort 2, but in this year, we also provided many grant funding opportunities, which is one of the recommendations from the framework. Pathways to resources. So part of those many grant funding opportunities was that they had to advance race or race equity within the housing or homelessness system, either internally or in their community. And then they had to touch one of the themes, which are creating a safe space for race, building racial transformers, representative leadership, or pathways to resources. And the 4 agencies that you see on the screen are the screens that were elected or selected to do the work. Now, the prerequisite of the many grant funding opportunity was you had to have gone through the initial cohort or collaborative. And that was important because you had some grounding to get ready to do the work. But when we think about creating systemic change, we have to allocate the funding to do the work. We can't just say that we want to create change around race equity, but we are not devoting the resources to them for that change to adequately take place. And so when I think about operationalizing the framework, I like to leave you with falling in love with the problem and not falling in love with the solution. Because sometimes we are so driven to figure it out that we forget about the process that it takes to get to the solution. So as we continue to operationalize the framework and we talk about the investments that are needed, I want us to lead through that process of change, thinking about how can I fall in love with the problem and not be so quick to just solve it, because there are all these things that you miss in between if you go directly from problem to solution. What's that process of getting there? Next slide, please. And so how do we move race forward in Connecticut? Continuing to pick up the race equity framework. If you have not had an opportunity to read it, we can make sure that you get a copy of that. And what we are doing at CSH is, again, in 2019, the framework was created by providers statewide. 2020, we have the 2.0 cohort. And in the fall, we will be having a race equity in the field summit that will be a virtual summit that is planned by cohort 2. This year, we also had the mini grants. And in 2021, there will be another cohort. So I even employ some of you when the application is released to come through the learning series and really force and stretch yourself to learn that so that you become a better practitioner in the field as we continue to move race forward in Connecticut. And I'm going to actually turn it over to Mia to talk about some of the things that CCEH is doing, because not only was Mia a participant of the legacy class, I like to call them the legacy cohort, but she's also a mini grant recipient. So as you can see, this collaboration goes beyond just what's on the paper, but it's something that actually happens in practice. And we wanted to make sure today when we were presenting that we demonstrated what collaboration looks like when you take an idea and then you begin to put action steps to it. Mia, I'll turn it over to you.
Thanks so much. So on the next slide, just wanted to highlight some important initiatives or efforts that we're engaging in. So we are continuing to collect data, examining for racial disparities, analyze that data. The COVID-19 HMIS fields are really helpful, a new, transformative ability now to be able to see how this particular pandemic is affecting our system, and be able to look at whether there are racial disparities there. Also, just wanted to encourage you all to, this is part of our work as well, encourage you all to analyzing and examining your data for racial disparities. So looking at things like length of stay, returns to homelessness, time from match to housing placement, and cause of homelessness. And within those categories, considering intersectionality, so not just examining by race, but also looking at race in LGBTQ, race and disabilities, race and gender, race and age range, and just and looking at several different types of cohorts of people and disaggregated by race to understand that there are subgroups that are disproportionately experiencing your program. And that's something that, we are improving on in terms of data. Linda and I just had a conversation in the data team, a conversation recently about, how can we improve our ability to analyze racial disparities? Perhaps it's a dashboard, perhaps it's, looking at, as we're going through this process, what are some particular gaps? Sometimes it's in how we extract the information. Are we counting people who are white and Hispanic in the white category, not counting people, or double counting people? So many different gaps you go into. I won't spend too long on this slide, but Monique already mentioned the CSH Collaborative for Race Equity, our involvement there, and we did receive the mini grant, and we'll be releasing an equity and access survey that is for people, not non-staff, so the community, clients, non-clients, people in the community, and we hope that you all support us in being able to distribute that to the people you are serving, as well as your family members, friends, people in your network, to understand equity and access itself, as well as the perception of access to services. We also started forming the Connecticut Race Equity Network, along with with Monique from CSH, Janita from Supportive Housing Works, and Carlene from the Partnership for Strong Communities. But this network will be a vast network that you all can also participate in, and there'll be more information coming out about that. I also participate in National Alliance's Race Equity Network, which inspired the Connecticut version. We're continuing training. Linda just mentioned an upcoming racialized trauma training that's coming up. We encourage you to attend and to further continuing furthering your education. I think C4, Center for Innovation, just released an online training where you can learn a little bit more about racialized trauma and race equity. I think also Center for Innovation, led by Mark Dones, also released an online program too. So just wanted to throw those out there. Lastly, we've been launching Housing Equals Justice. This will be the theme of our annual training institute, which you'll be receiving more information about, as well as some of our legislative priorities and efforts that's going on. Internally, we've been doing a lot of difficult, uncomfortable conversations about race, and we encourage you all to do that as well, forming an internal race equity task force that will help to permeate race equity throughout all of our projects and programs. And we also will be doing some HR related type work on how we can become a more equitable organization internally for staff members that are working at CCH. So on the next slide, we're going to close it out. I'll hand it back over to Mo.
Thanks, Mia. And so when and we don't have the time to really have a robust dialogue today, but we wanted to leave you with these thoughts and questions about what's your role in it all. And what are some of the gaps that maybe you've identified around race in your organization that need to be addressed? And how can you engage in this process considering the current pandemic? And so what we know that COVID has taught us, right? COVID has had a major impact on the way we serve, but the disparities really, I want us to remember, existed prior to COVID. What COVID-19 did was expose those disparities really even more and brought them to the forefront, which made race even more so an urgency. So as we think about your role in it, how are you giving up or shifting power? How are you willing to say that there are some things that maybe we didn't do right? There are some things that we got wrong, and maybe look at the fact that we've been operating from a perspective of dismissing white domination and racial conditioning, and think about how we begin to develop racial stamina and strive to become anti-racist. And that is moving from just saying we're going to have a conversation about race, but where race becomes a part of every conversation. It's not a separate thing, but it's embedded in every fabric of what you do. And that takes time and it takes work. It does not happen overnight, but that's the process of incorporating your role in it all. Because now we have to start bringing those voices to the table that we speak about, for them to speak in those conversations, for them to pull up their seats to the table so that they can begin to speak for themselves. And that means we're creating shared power, which requires us to be willing to sit and listen and actually think, after you listen and hear what you heard, what's the action that's going to take place? And then action taking place based on what you've been told that you would like to see happen, and not what you think is the best thing to be done. And it's uncomfortable. And so, in thinking about that, really want you to be reflective on your role in it all. And I would like, we're going to ask John to actually share some of the things that CT BOS is rolling out and their role in making sure that race equity is advanced throughout Connecticut.
Thanks, Mia and Monique. Oh, wow, you've packed a lot into a very short period of time, and I appreciate just all that you've given us to think about. I think I would say that BOS has just started to tip its toe into the water of this conversation, and we've done a couple things, but I love the comment that was made: embrace and love the problem and enjoy the journey from problem to solution. So while I can give you a couple examples of what we've done so far, I do want to let folks know that we're committed to this as an ongoing conversation. This is not a one and done, even though this presentation may be a one and done. The journey that we're all going to be on together is one that we all have to embrace, and BOS, the leadership, will continue to carry that forward. So speaking of the leadership, as I was looking at the slides, I would say under representative leadership, we have two examples. One is, you'll see that we're adding a fourth chair to the officers of the steering committee, specifically to allow for increased diversity, racial ethnic diversity. We also recently encouraged each of the CANs to have one of their two representatives be a person of color, and that we were successful in all but one, and they're continuing to work to do outreach. And when that person is identified, one of the current representatives will step off as a CAN representative. So that's the two things we've done under representative leadership. In terms of lived experience, you all heard at our last steering committee meeting that we were pleased to announce that CSH won the RFP for the peer involvement, and that racial equity is just so integrated into that work. So we're pleased to be able to go on that journey with CSH around peer involvement. Now, I don't know if this is the right category because I'm doing this on the fly, but under operationalizing, two things to point out in the new project RFP that we just released. We ask providers to describe how they ensure diversity on their board, how they analyze program outcomes based on race, ethnicity, and how they plan to address disparate outcomes and hire program participants. So that's one thing. And then the other thing we've added, because one of the slides had some missing data, and I think data is so important to inform us. So we've added race, ethnicity to the BOS consumer survey so that we can actually look at satisfaction of services by race and ethnicity. And so if we see that only the white consumers are happy and BIPOCs are not happy, we'll be able to actually have the data to do something around that. So again, these are just baby steps toward a much larger goal that we hope to all do together, but did want to let everyone know that we've taken it seriously. We started to operationalize these changes. And again, as Mia and Monique said, the leadership can't do this in a vacuum. So we are really going to rely heavily on all of you to offer suggestions. You know that I always say we're here at your disposal 24/7. Usually it's related to sort of the nuts and bolts of BOS work, but this is the nuts and bolts of BOS work. And so we want you to give us suggestions today, tomorrow, next week, next month, next year, so that we can get to a better place, not only as BOS, but as a nation. So I just want to thank Monique and Mia for their time. The next slide will give you their contact information. And I'd say hats off to you, but mine is tied on. But really appreciate all that you did today.
Thank you so much. And thank you for having us and providing us with the opportunity to really add value to what we do statewide together.
Absolutely, absolutely. So Bo just had a hat change. I want to point that out to you as we move to the last slides, which are our next steps and resources. These are the ones that we do at the end. Reminder, we do have a steering committee meeting on August 21st. Note the time change. At the last meeting, because we're doing these every other week now, we're able to push that back to 11 o'clock to 12 o'clock. We're keeping it to 1 hour because no one in their right mind wants to be on a Zoom call after 12 o'clock on a Friday, especially in the summer. So we're back to 11 o'clock. This is the link for that, and that is when we will vote on the fourth person for the fourth chair. So either nominate yourself or get somebody that you know who's willing to serve as the fourth steering committee chair, and we will have that discussion then. Our next slide, next office hours will be on the 7th. And on September 11th. And we're going to play that by ear, certainly as it relates to the September 11th meeting. If we don't have substance that we can share with you, if there's not a topic, we may skip that one. But again, if there's a topic that has popped up that you think is important, let us know and we'll work it into our schedule, which is one meeting is for BOS, sort of nitty-gritty governance work, and then the next is a deep dive into a topic. So we'll switch back and forth between those two, but if you've got a topic you want us to do a deep dive, and when I say deep dive, that's 25 to 30 minutes. Certainly we're willing to do that. Just a reminder, as I said at the beginning, the next slide has a link for every office hour response to the questions that have shown up in our chat box. Here's the email to ask questions day or night. Click on that link and we'll get the answers that we can when we can. Just a reminder that if you want to sign up, or if any of your friends want to sign up, Here's the link to the BOS emails. You don't have to send a specific email to Liz or to Lauren or to anyone else. You just click on that link and it takes you right to this very sophisticated portal where you sign up for our emails. And we want as many people to be informed as possible. The next slide shows you some of our partners that presented today, as well as the national level, their webinars, their responses, their online learning series. There's lots of information out there, and we just want to make sure that you have those resources, as well as the next slide, which is even more information, both from the Connecticut level and the national level. So if anyone ever says to me, I didn't know, you didn't provide that information to me, I can point these slides out to you. So again, we're an open book. We want you to have as much resources as you possibly can. And again, our last slide is always the email links to the COC support, which is Housing Innovations. They're the consulting firm that we rely oh so heavily on to do all of our really heavy lifting and our deep thinking. All I do is put on a funny hat and walk through some slides, but they're the ones who really have all the answers to your burning questions. So I think we're just about out of time. I'll give folks 1 second if they've got a last burning question to put it in the chat box. Okay, seeing none, again, I want to thank Mia and Monique, Linda and Steve for updating us, along with Alana. Suzanne Wagner can now officially start her vacation. And again, you know, folks, we're all in this together. We're doing the best we can. Be kind to yourself, be kind to those around you. We'll get through this. We'll be a better nation. We'll be better people because of the hard work that we have agreed to do together. So with that, God bless and have a good weekend.
Thank you.